I was diagnosed with atopic dermatitis at the age of 32 years old. Before I was diagnosed with atopic dermatitis, the symptoms that I saw at that time were basically scaly, dry skin. Sometimes it would go into blisters. Those two elements were pretty much what I saw during that time before I was diagnosed. Most of my dermatitis was affected from my neck on down to my toes. During that time, the most symptoms that bothered me with the dermatitis was the blisters on my skin. That was the most I would say the most dramatic part of the dermatitis.
Okay. And what impact did these symptoms have on your life? Sleeping, your ability to function normally during the day, at work, that kind of thing?
Usually, the symptoms don't bother, but if they did bother me, it would be during the spring and summer months, where you have pollen falling and it's falling onto the skin, and that will kind of create more of a set. I would say a set off of the eczema, which would cause me to scratch from itching, and that would be the most uncomfortable part of it. What I did to manage my symptoms with atopic dermatitis, I used more. I tried to use some topical creams, maybe some non-fragrance lotions. For example, Aveeno I would use. Other than that, I would use coconut oil. Any type of topical cream of oil without any fragrance, I would use to pretty much to kind of pacify my skin. And that would help as far as to keep it moisturized, during the day and during the night. Just more of a pacification with the creams. But it really would not solve the problem, but it will help by just keeping the skin moisturized. I went to seek a physician for the atopic dermatitis due to the fact that my symptoms became worse. It became worse as far as I itched more, and the blisters were noticeable more. I saw myself scratching more, and on different part of my body parts that I would have breakouts. And I knew something was not right. And so I went to seek a physician and to get some treatment. 10 years ago, when I first went to see a physician, I told him what was going on, and he started me off with steroid injections in the buttocks. And I believe during that time I had maybe 2 buttock injections of steroids, and that would help in the process of pacifying the breakouts, but it did not solve the problem. And from that point on, it became worse and worse. And from that point, he started giving me tablets, which were steroid tablets instead of the steroid injections. And so the tablets was pretty much just pacify me at that time also. But during that time, was more of taking maybe oatmeal baths, just buying oatmeal and just pouring in the bath water, and maybe take a nice 15-20 minute bath, and just kind of soak my skin in the solution, and that would help. But still, it just would pacify the skin. But I still had breakouts, after. But as far as treatment, that type of treatment, yeah, baths, using oatmeal, that's pretty much he told me to do. Well, I can say from taking the oatmeal baths, I did see some improvement as far as a decrease in the in my skin as far as the blisters. The blisters pretty much dried up, and mainly I had the blisters pretty much from my knee down, more on the ankle part of my body. And so me taking the oatmeal baths, I would say daily, was very helpful with the eczema, and especially with the blisters and the scaling of the skin.
Okay, I'm going to ask you to try to give me an idea how severe your itching was at this point in time. So if we can go from 1, which means rarely bothered me, to 10, I just wanted to kind of tear my hair out. Where would you put yourself on that scale of bothersome?
I would say a 9, because the itching became so severe that it felt like I wanted to scratch my skin with a bristle metal brush. That's how severe the itching was. And I, was told scratching the skin is not good, with the fingernails carrying a lot of germs. So I just tried to use more like a cream just to soothe, or I will kind of like just wash, the part that was itching the most, and just try to keep it moisturized as much as possible so that I wouldn't scratch.
How often are you taking the oral dexamethasone?
I take the dexamethasone for the atopic dermatitis once daily, and I usually take it. I do my best to take it early in the morning. Sometimes I go take it maybe in the afternoon, because I have to eat food, some type of food, to before I take the tablet, just to have some type of food on my stomach. But the dexamethasone has been a great help as far as slowing down my breakouts. And but I'm just tired of taking the tablets altogether. So I'm just tired of taking any tablet. I just want to be free of taking tablets. It's very rare. It's very rare when I itch when I take the meds, or when I take the dexamethasone. It's very rare I itch. It's very rare. If I do itch, maybe I went outside and for a while, and maybe the elements on my the elements from outside maybe falling on my skin. Like now, the pollen is very heavy, so that would be a trigger for me to itch. I have not had any side effects from taking the dexamethasone. Before the dexamethasone was, prednisone, 20 milligrams, that I was taking for, I would say, over a year. I gained maybe 30 pounds in approximately a year. There have been times that I have missed to take the tablet, maybe 1 or 2 days out of the week. Maybe I just had a busy day and I just forgot to take the tablet, but that's not good, because I just don't want it to. I just don't want it. I don't want to have a breakout. I just would like to be free from taking any tablet, any injection, and just be back normal and just having normal skin.
Oh, I totally understand. Are you still doing the what we call basic management of bathing, using creams and emollients to keep your skin hydrated. Are you still doing those things on a daily basis?
Yes, on a daily basis, I'm using before, without taking the tablet, I do the just the basic treatments as far as if I shower, I try to take a shower under 3 minutes because water can dry out the skin. So I try to get in and quickly as possible and get out. And usually I try to air dry instead of use a towel. And once I'm dry to a point, I use a non-fragrance cream for my skin, and I try to moisturize as much as possible. And that's pretty much what I do. Also, besides the cream, I use a non-fragrance soap, bar soap, and that would be Dove with no fragrance. I use cream, a body lotion with no fragrance. Now, presently, I would say that I am much better now, much better now than in the past. I would say from the basic treatments of the baths, the showers, as far as using the Dove body soap, no fragrance, and the cream, and just keep my skin moisturized as possible, has been very helpful. I feel better now than I felt in the past 5 years.